I'm here with Roger Ohanesian, who's the 2022 honoree with the Chang-Crandall Humanitarian Award of the ASCRS Foundation. Roger, congratulations, and tell us how the Armenian Eye Care Project, which you started 30 years ago, came into being.
Well, it was very interesting. I was in a successful practice for multiple years, and 30 years ago, I received a fax in the mail, and the fax indicated that the country of Armenia, which had been at war with Azerbaijan, was now in terrible shape because so many of the doctors had gone out to help in at the places of the war, that many of the doctors that were back home in Yerevan were overwhelmed. Patients were in the corridors, and it was very difficult.
And there was a lack of both knowledge and supplies, right? Because this was at the time of the breakup of the Soviet Union in 1991, and prior to that, in 1988, there had been an earthquake in Armenia.
There had been. Actually, they had lost an awful lot of people in the earthquake, and then again, when this war started, it became a very difficult arrangement that the doctors who had been able to go out and treat patients easily, now it became a much more difficult thing to do. And so at this point in time, the Minister of Health sent out a letter to all the people who were in the Armenian American Medical Society to see if they could help.
And you were one.
I was one. And so I, of course, spoke with my wife to make sure everything was okay. I had planned a trip, actually, away from the office. I had planned a trip to join her in England with my son. They had already gone, and so I asked her if she would mind if I then took another week or two and spent it in Armenia. And I told her what it was about, and she said, well, go. She said, I envy you for being able to help out like that. So I went to Armenia, not knowing where the country was, not knowing how to get there. I asked a couple of people that I knew, and they gave me directions and who to call. And after calling Levon Travel, the travel agent, I found myself booked on the next couple of days on a trip to Armenia.
And tell me what you discovered when you arrived.
Well, fortunately, I had met Alex Molayan, who was the chief of the Republican hospital, as it was then called. He had come over to America with another Dick Casper, another ophthalmologist who I knew quite well, and Dick had introduced me to him. So when I was going to Armenia, I at least knew one person in Armenia, and that was the chief of ophthalmology at the Republican hospital, eye hospital. So when I went, Alex was there to meet me and brought me back and had arranged a place for me to stay, and I had brought numerous pieces of equipment with me, as well as antibiotics and anesthetics. So after spending a night there, I went the next day to the hospital, to the operating room, and we started to perform surgeries as well as look at patients.
What was the state of equipment and training and the infrastructure in Armenia at that time?
At that point, they actually had archaic equipment. And it really, Alex had his own set of equipment, and so he would bring that out whenever he was operating. And the same was true with many other doctors that were there. But they didn't have usually the level of equipment that he had. I was amazed at the conditions in the operating room, because at that point in time they had you might find cats roaming around in the corridors, as well as those that sometimes came in the operating room. Mm. Most times I found that they weren't there, which was fortunate. But just the fact that all the doors were open was quite remarkable to me.
It must have been overwhelming to see the sheer number of patients who needed help on those early trips.
I can remember going into a room, John, and seeing 25, 28 patients, all with sunglasses on. Mm. They had sunglasses on because they had been injured in one or both eyes. They had the sunglasses on so they wouldn't frighten people. That's how ghastly they looked. And when they took the sunglasses off, we were able to examine them, and I found so many times that they had quite severe injuries that didn't look as if they had been treated. And so consequently, we started treatment on them, some that required corneal surgeries, others, frankly, that required removal of the eye. And that was something that was quite alarming to them as well as to us.
You realized that you alone couldn't deliver all the care that was needed, and so you brought in help. You brought in other physicians, and talk about some of the people who came along and helped you.
After this initial trip, which was about a 2-week period of time, I came away. I had operated on several people, and I came away with the feeling that I needed to do more. And with that, when I went back to America, I started to speak to my colleagues, and one of whom was Rick Hill. I had operated on a young girl that had glaucoma and did a trabeculectomy on her, but she had a thing known as uveitic glaucoma and caused inflammation to the inside of the eye. And that's what caused her glaucoma. Well, it also caused the destruction of the surgical procedure that I had performed for the trabeculectomy. Consequently, it would require some of the newer, more investigative procedures at that time in order to get the eye to function properly. So I went to Rick Hill, who was a glaucoma specialist in Irvine and at the university. He was in charge of glaucoma, and he had invented an instrument that could be placed within the eye that would allow the drainage of the fluid within the eye, which is what is present in glaucoma. And so when he was able to do that procedure, he was able to get the pressures down, and they would stay down, something I was very grateful for. So he came with me. He was the first person that came with me. But in actual fact, when I first went there, the same letter that had been sent around to the Armenian American Medical Society attracted Sarkis Sukiasyan, a doctor from Boston, who was a cornea specialist. And so when we were both there together, and when I was helping him, he was often performing cornea transplants, and they were quite successful, and some weren't. But it was necessary that we do something about that, and that's what. When he came the next time, that's when we tried to establish a cornea eye bank.
What about training physicians? So it was one thing to bring people who could help, but to help a greater population really required people there who could stay and follow up the patient. So how did you address that problem?
It was necessary to get the doctors there to be able to learn more. Every doctor that I met in Armenia when I first went there was a general ophthalmologist. There were no specialists. There was no one that was going to hone in and specialize on this one particular area. And so it became necessary to get them further trained. I was fortunate because on each subsequent trip that I came, and I was coming every 6 months to the country, so on each trip I would try to bring more doctors. Rick Hill was there all the time for me as a professor at the University of California, Irvine. He was able to help out recruiting other doctors. And we got Barry Cooperman to come with us. Barry was the chief of retina. Barry, when he came, did a lot of the retina procedures that were ones that I wouldn't be able to do. And he was able to get and recognize some of the people who were interested in retina and recommended that they come to California to get a fellowship training. I had asked him about fellowship training before, and he recognized that there was one or two of the doctors that were there and brought them over.
Rick Hill did the same, and we've had fellows in many different institutions.
Cornea, glaucoma, neuro-ophthalmology, plastic surgery. It was great.
How did those doctors who were fellowship trained in the U.S. then impact things in Armenia?
That became such an amazing thing because they came over, and obviously some of these were women who were the chief of glaucoma, the chief of various, that were within the practice in Malayan Eye Institute. And one of these, Lilith Voskanyan, was a young mother, and she had children, and so I told her that she could, of course, bring her family over with her. And this was the same with others. So Armin Vartanian came with his family, and Lilith with hers. It was the only way that we could really do it that would be fair to the Armenians. We paid for a place for them to stay and a place for transportation and so forth. And it worked out very well. They were able to train for as long as a year and sometimes a little longer. And they went back to Armenia, and they all went back. People have told me that people wouldn't go back. If you made it too good for them here, they wouldn't go back. That's not true at all. All of these doctors went back. And when they went back to clinics that we had outfitted so that all the equipment that they had in America, they were able to get in Armenia.
And much of that care they gave free to the vulnerable
That's
people
right.
in Armenia.
That's right. And the beauty of it is they became rock stars. They were everyone knew of them. Everyone knew that they had been to America and had trained in America. And that was a key. That was such an important factor for others that they built practices very quickly.
At some point, you realized that in Armenia, a country of 3 million people, only 1 million lived in the capital city of Yerevan, and 2 million lived outside.
Yeah.
And so you recognized that there was the poorest, most vulnerable population was the least accessible.
That's right.
How did you decide to address that?
Well, that conversation I had with a journalist colleague of ours, and I at first thought that it would be a good idea to take some of those specialists who were in the capital and to bring them out to the hinterland, out to the remote areas, and so that they could assist them and operate on them. I didn't realize that these areas, these regional areas, were so ill-equipped. And so, although you had someone that could use the most modern of lasers to be able to treat certain diseases, they couldn't do it out there because they didn't have the equipment. And at that point in time, I didn't have enough money to be able to go and buy new equipment for each and every small clinic that was there. So it was necessary to build a mobile eye hospital. And I was able to find a place that could build them, and went ahead and built one that had 2 examination rooms, 2 lasers, and a fully equipped operating room and fully equipped examination rooms.
It was over $1 million investment to build,
yes.
and you had naysayers who told you from experience in other countries not to do it, but you did it anyway. So how did it work?
It worked fantastically well, and still does. That was the Mobile Eye Hospital has gone around the country and has done more than 100,000 cases on board. And the beauty of it is that the doctors that are operating on it, we pay them. The Armenian Eye Care Project pays a salary from them to do that. And so as they go around the entire country, they're operating on people who have no money. And so they do it for free. And it has worked. It's worked very well. I'm very pleased with it.
So all the care on the Mobile Eye Hospital was completely free to the local population.
Yes.
But you realized that the hospital couldn't serve the entire country of 2 million outside Yerevan because it took some time for it to get
That's
from
right.
place to place.
That's right. And that was basically after we learned that in about a 2 or 3 year period of time, and learned that it took the hospital, Mobile Eye Hospital, about 2 years to go around the entire country, to rotate around the entire country. All that period of time, they would have screenings, they would have they would see all the diabetics, they would see all the other people that we knew that would potentially have eye diseases. But it just took too long to make a tour. It was, some of these patients needed to be seen more than once every 2 years. So there came the idea then we needed clinics, specialized clinics in the various regions to be able to take care of all of that. And that's where the regional eye clinics came to be. And we realized that they cost about $1 million apiece, and we've thus far put in 5 of them. And they've done very well. They put in 5 regional eye clinics, and as well been able to make some of them more specialized in certain diseases. And it's worked very well. We're very pleased with it.
The population screening you're doing, talk a little bit about that for diabetes.
Well, what we have is we let everyone know. I mean, everyone's got television there, so we let everyone know by an ad that we're coming, and we've got the mobile eye hospital, and we're going to be going in your area at such and such a time. So please come there and to be screened, and so you can be seen and make sure that everything is fine, particularly if you're diabetic. And it goes on and on. So when we arrive, there's masses of people waiting. And now we've been able to purchase some very expensive but very valued piece of equipment, such as a camera that will take a photograph of your eye without having to put dilating drops in. It'll take a photograph of the eye under UV light, ultraviolet light, and it doesn't harm the eye at all, but what it does do, it takes a picture of the retina, and it'll be sent to the cloud. And the cloud then, by artificial intelligence, recognizes any amounts of diabetic retinopathy. It's been fantastic. It'll send the information back to you within a minute, and it'll say whether it's a grade 1, 2, 3, or 4. If it's 3 or 4, it means there is diabetic retinopathy and it's visually significant. 1 and 2, patients are recommended that they come back in 6 months to be rechecked. But 3 and 4, we take them right into the laser room and treat them, which saves us a lot of time and effort. And know that these people are going to be treated and they won't go blind from the diabetic retinopathy.
Talk to us about corporate support, because you've had some companies help as well.
We've been very fortunate that many of the laser companies and the equipment companies have been able to support us. These are ones that are the major ophthalmic equipment companies in the country, in the United States. Alcon, Allergan, Bausch & Lomb, all have been.
Johnson & Johnson, Zeiss. Every major company and many small.
Yes.
Glaukos has been very supportive.
Yeah.
Startup companies as well have been supportive.
Yeah, and Zeiss has given us surgical microscopes that are really so important to have. And we've also had help from organizations like the World Diabetic Foundation and USAID, who have given us a monetary cost so that we can buy the equipment that we need, as well as to give payment to the doctors who are on these mobile eye hospitals.
And the WHO has recognized the Eye Care Project for its ability to create a model for other countries.
Yes.
Talk a little bit about the education conferences and collaborations that have happened, including with Children's Hospital Los Angeles, and some of the training that's happening in the region.
What's been great is, on the trips that I go to Armenia, they initially had been every 6 months, and I did that for about 10 years, and then reduced down to once a year. And I find that I can bring with me a number of doctors, sometimes as many as 30 doctors will come with us. And they will all scatter into the various areas and be able to practice what they know best. The beauty is that the conferences themselves are very well attended certainly by the Armenians, and as well by other countries who learn of the meeting and the conference and send in some of their ophthalmologists. And that's been terrific. There are others that have asked if they can train in Armenia. And so our Armenian doctors have several fellows themselves that are in training. They themselves have been trained in America. They are now giving that information to others that are in the country. It's been really very gratifying.
What has it meant to you personally? Because a lot of the doctors who come to Armenia, more than half are not Armenian who come, but you
That's
are.
true. Yeah.
And what does it mean personally to you that you've been able to accomplish this in your career?
It's been a lifelong dream of mine to be able to help out the country. I learned of how bad things were in the country from my grandfather, who went back and fought in 1915 to 23 against the genocide that was going on. And to know that at least they're made better off from the skill that I have learned in ophthalmology here in America, I've been able to train others so that their skills are high. And it's been really gratifying. Plus, I've met an awful lot of people like yourself and Tom Lee and Rick Hill, numerous people who have come with me, and not even Armenians. Many of them will just help out just because they are enjoying helping out and feel, as Tom Lee does, that it's one of the most gratifying things that he's done and the best use of his medical license.
You've mentioned some of the great names of volunteers with the project. A couple of others, Tony Aldave.
Oh, Tony Aldave has been superb. Specialist in cornea. He's brought over corneal tissue as well as of corneal artificial corneas that can be used for so many people who have gotten injured. Unfortunately, as you know, there's been another war. Azerbaijan attacked Armenia, and in just a year ago, 2020, and in a 45-day period of time, caused an awful lot of injuries and penetrating injuries into the inside of the eye from these explosive devices that they had. So we've now been able to train people that can do retinal work and be able to remove these particles. And it's been very gratifying to see that they are able to do it themselves. They don't need the expertise that the Americans have. They actually have learned it themselves.
Roger, you've lived a life that has had a greater impact than most of us will ever have. It's remarkable what you've accomplished in Armenia. It's remarkable how you've done it with a team and how people have followed your inspiration. You are the 2022 honoree for the Chang-Crandall Humanitarian Award from the ASCRS Foundation. Congratulations.
Well, thank you. Thank you, John. And I have to say is that it is because of the group of us that are within the Armenian Eye Care Project, yourself included, who have seen what it produces. And it's really, I look at it and am proud of the fact that it has been able to do all these things and that others are quite interested in doing the very same. So thank you.
How does it feel to receive this award?
Oh, thank you. It's a great honor to receive the award from my organization, from peers that look across all the humanitarian organizations and has chosen the Armenian Eye Care Project as the one that they can support for the calendar year 2022. I'm overwhelmed with with gratitude for what they've done.